Hello and welcome. If you're preparing for radiation therapy for uterine cancer, you are in exactly the right place. Our goal here is to walk you through the whole journey, step by step, to make it feel a lot clearer and way more manageable.
Think of this as our roadmap, you and me. We're going to break down what to expect, why it's happening, and how you can be a really active partner in your own care. Okay, you ready? Let's dive in.
All right, so let's start with the biggest question of all. Why? Why has your team recommended this specific treatment? What's the main goal here?
Well, for most patients, radiation happens after a hysterectomy. And you can think of it like a cleanup crew. It's a local treatment, and its whole job is to target any tiny microscopic cancer cells that might have been left behind. This just dramatically lowers the risk of the cancer ever coming back.
And you know what? It works. Modern, really carefully planned radiation therapy is incredibly effective. We're talking about preventing the cancer from returning in that area in about 85 to 95% of patients 5 years down the road. That is a really powerful and reassuring number.
Now, this is so important to understand. There is no one-size-fits-all treatment. Your care team creates a plan that is totally customized for you, and it's all based on the specific details they find in your pathology report after surgery.
So your plan will probably involve one of two main types of radiation, or maybe even both. First, there's external radiation, which is called Pelvic IMRT, which treats the wider pelvic area from the outside. And then there's internal radiation, or HDR brachytherapy, which gives a really focused treatment from the inside. So let's look at what helps your team decide what's best for you.
One of the first things they look at is the tumor's grade. This is really just a score for how aggressive the cancer cells look under a microscope. So, a higher grade might mean your team decides to be extra thorough with a more comprehensive treatment plan.
Another really important detail is something called LVSI. Basically, if cancer cells are spotted in these tiny blood or lymph vessels, it's a little signal that the cancer might have had the potential to travel. So, finding this often means that treating that broader pelvic area with external radiation is a really smart idea.
And finally, here's a term you are definitely going to hear: the vaginal cuff. It sounds complicated, but it's not. It's just the area at the very top of the vagina where your uterus used to be. And here's the crucial part. It is the single most common spot for uterine cancer to come back. That's why protecting it is a huge goal of every single treatment plan.
Okay, so let's get practical. How does all this translate to your day-to-day life during treatment? What does a typical visit actually look and feel like?
Well, if you're having external radiation, that's the IMRT, your daily routine is going to be quick and predictable. It's usually Monday through Friday for about 5 weeks. The whole visit is only about 15 to 20 minutes, and the radiation itself, it's only on for a few minutes of that time. You don't see it, you don't feel it, and then you're done for the day.
Now for the internal treatment, the brachytherapy, the process is also really straightforward. A smooth cylinder, kind of like a tampon, is gently placed inside. They do a quick image check to make sure it's perfect, and then a tiny, computer-controlled radiation source does its job for just a few minutes. Then everything is removed, and you're all done. It's done right in the clinic and usually doesn't even require anesthesia.
Okay, let's bust one of the biggest myths about radiation right here, right now. Once that tiny source is removed at the end of your session, the radiation is gone, period. You are completely 100% safe to hug your family, play with your grandkids, and be close to all your loved ones immediately.
Of course, one of the biggest questions on everyone's mind is about side effects. So let's talk about them head on. And more importantly, let's talk about how your team helps you manage them.
The most important thing to take away here is that you are not on your own with this at all. Side effects are expected, but they are almost always temporary, and they are very manageable. Your team has a whole toolkit of strategies, from medications to simple diet tips to keep you as comfortable as possible. So, during the treatment and for a few weeks after, you might notice some temporary stuff. Things like changes in your bowel or bladder habits, maybe some fatigue. These effects usually build up a bit toward the end of treatment, and then they steadily get better and go away.
Longer-term effects? They're pretty uncommon, but we want you to know about them. The most significant one is a change in the vaginal tissue that can cause dryness or narrowing. But, and this is the crucial part, this is largely preventable. And that brings us to the really empowering part, your role in your own recovery.
This is where you become a key player on your own team. There are simple, proactive things you can do to make a huge difference in your long-term wellness and comfort.
And honestly, this is the big one. Using a vaginal dilator is such a simple but powerful tool. It helps keep the vaginal tissues flexible and healthy. And that's vital, not just for comfortable intimacy down the road, but also for making sure your future pelvic exams are easy and totally pain-free.
Don't worry, your team will give you plenty of coaching and tell you exactly when to start. But the process itself is super simple. It just takes a few minutes, a couple of times a week, and it can make a world of difference for your long-term health and comfort.
And finally, let's look ahead. What does life look like after you've rung that bell and finished your therapy? What's next?
Let's just hit this one more time because it is so important. The answer is a huge, emphatic no. The radiation source is completely removed after every single session. You are never, ever radioactive.
This is another really common and important question. Generally, you can get back to sexual activity as soon as you feel comfortable and any initial soreness is healed up, which is usually just a few weeks after treatment ends. Your clinician will give you the green light, and just remember that lubricants and open communication are your best friends.
So here's the bottom line. From your very first planning scan, all the way through treatment and into your long-term follow-up, you are surrounded by a whole team of experts. They are all there with one single goal: to guide you, to support you, and to see you thrive. You are not doing this alone.